of health and well-being. As a collective, let's delve into the profound realm of symptoms, conditions, diagnosis, and treatment. Together, we uncover the secrets of maintaining vitality. Your shared curiosity is our compass. Join us on this enlightening journey into the art and science of proactive health. Good day, ladies and gentlemen. My name is Lian Z. Mayarmita, serving as one of the group presenter. Now, let's start with the introduction. Understanding the significance of symptoms and conditions is a paramount for proactive healthcare. Timely recognition, accurate diagnosis, and appropriate treatment form the cornerstone of effective medical care. This knowledge empowers individuals to address health concerns promptly, facilitating early intervention and better outcomes. A vigilant approach to symptoms ensures a proactive response to potential health issues, fostering overall well-being and preventing complications. Broth. Broth is like an odd sound detected when doctors listen to our heart with a stethoscope. Imagine it as a signal that something might be off with our heart, and doctors pay special attention to it during checkups. Cardiac tamponade. Think of our heart being in a bag. Sometimes this bag collects extra fluid due to sickness or heart injury, causing what's called cardiac tamponade. It's like putting pressure on the space around your heart, making it work less effectively. Next is ectopic beat. Normally, our heart beats with a regular rhythm controlled by a special area called the SA node. But sometimes the heartbeat starts from a different spot, creating an ectopic beat. It's like your heart momentarily dancing to its own rhythm. Extrasystole. Ang extrasystole ay ang mas maaga at karagdagang tibok ng puso na hindi sumusunod sa regular na ritmo. Parang ang puso mo ay biglang nag-iibang direksyon at tumitibok ng hindi tamang oras. Ito ay maaaring mangyari sa ibang bahagi ng puso na maliban sa karaniwang pinagmulan. Next is the flutter. Flutter is like a super fast and steady heart rhythm, racing at 200 to 300 beats per minute. When we say flutter, it's like your heart is in a bit of speedy rhythm, beating way faster than its usual pace. It's a bit like when music plays really quickly and your heart decided to follow that rapid beat. Hypotension. Hypotension is when your blood pressure is lower than what's considered normal. Imagine the force of your blood against your blood vessel wall and being weaker than usual. This might make you feel a bit dizzy or lightheaded.
Good day everyone, I am Princess Aizuran Mendoza from BSN1F and I'm here to discuss some symptoms and condition. First is we have the intermittent claudication. Intermittent claudication, it is a pain in muscle during exercise caused by inadequate blood supply. The pain disappears with rest. Ang intermittent claudication po, it is a pain affecting the calf and most commonly the thigh and yung puwet po natin na sanhi po ng pag-exercise. And nababawasan lang po ito sa pamamagitan po ng pagpapahinga. Next is we have the mitral valve prolapse. Mitral valve prolapse, it is a movement of the mitral valve cast into the left atrium when the ventricle contract. Ang mitral valve prolapse naman po, it is a heart condition where the valve between the left atrium and the ventricle called mitral valve doesn't close properly. Instead of closing tightly po, the valve flap bulge back into the left atrium. This can cause po blood to leak backward into the left atrium, which is known as the mitral regurgitation. Next is we have the occlusive vascular disease. Arteriosclerotic disease of the vessels, usually peripheral vessels. Occlusive vascular disease po refers to a group of condition that involves narrowing or blockage of blood vessels, which can restrict blood flow to the various parts of the bodies. This can occur in arteries or vein. One of the common type po ng One of the common type po ng occlusive vascular disease is the arteriosclerosis, which involve the build-up of plaque inside the arteries. Next is we have the palpitation. Palpitation is the sensation of abnormally rapid or irregular heartbeat. We all know naman po what palpitation is. Ang palpitation po is yun po yung nararamdaman po natin na mabilis, hindi regular, or mas malakas na tibok po ng puso natin. Na nararamdaman po natin every time na kinakabahan tayo, na nababahala tayo, na nababalisa tayo. And minsan nararamdaman din po natin ito lalo na kapag napaparami po tayo sa pag-inom ng kape. Next is we have the pitting edema. Edema that retains the impression of a finger pressed firmly into the skin. Pitting edema, it is a condition characterized by swelling or fluid retention resulting in the formation of an indentation or pit when the pressure is applied in the affected areas. It is commonly seen in feet, legs, and hands and other extremities. Next is we have the polyarteritis nodosa, potentially fatal collagen disease causing inflammation of small visceral arteries. Symptoms depend on the organ affected. Polyarteritis nodosa, it is a rare autoimmune disease that involves inflammation of the blood vessels. It is primarily affects the medium-sized arteries, leading to damage or impaired blood flow to various organs and tissues in the body. Next is we have the Raynaud disease, a disorder characterized by abnormal constriction of peripheral vessels in the arms and legs on exposure to cold. Raynaud's disease, also known as the Raynaud's phenomenon or Raynaud's syndrome, is a condition that affects the blood vessels, primarily the fingers and toes. Now let's call on for the next reporter.
So, good day everyone. I'm Sarah Migranio. I'm here to continue the discussion about the symptoms and condition. So, first it is about regurgitation. So, regurgitation, it is a backward flow such as a backflow of the blood through a defective valve. In other meaning, regurgitation means leaking from a valve that does not close to all the way. The external structure of the heart includes the ventricles, atria, veins, and arteries. Next, it's about stasis. Stasis, it is a stoppage of a normal flow as of blood or urine. Blood stasis may lead to dermatitis and ulcer formation. So, stasis is a stoppage or slowdown in the flow of the blood or other body fluids such as lymph. For example, status ulcer is an ulcer that develops in an area in which the circulation is sluggish and venous return is full. Subacute bacterial endocarditis. It is a bacterial growth in heart or valve previously damaged by rheumatic fever. In other terms, subacute bacterial endocarditis or infective endocarditis is an indolent bacterial infection in the heart, often caused by the instruction of bacteria in the bloodstream at the same time of a nostril, surgical, or medical procedures. Tetralogy of Fallot. It is a combination of 4 congenital heart abnormalities such as pulmonary artery stenosis, interventricular septal defect, displacement of the aorta to the right, and right ventricular hypertrophy. So, tetralogy of Fallot is a heart defect made up of 4 different heart problems. It like ventricular septal defect, overriding aorta pulmonary stenosis, and right ventricular hypertrophy. It is a birth defect that affects normal blood flow through the heart. It happens when a baby's heart does not form correctly as the baby grows and develop in the mother womb during the pregnancy. Thromboangiitis obliterans. It is an inflammation and thrombus formation resulting in occlusion of small vessels, especially in the legs, most common in the young men and correlated with heavy smoking. Thrombotic occlusion of legs vessel may lead to gangrene of the feet. A patient show a hypersensitivity to tobacco, also called Buerger disease. Thromboangiitis obliterans is caused by small blood vessels that become inflamed and swollen. The blood vessels then narrow or get blocked in or by blood clots, also called thrombosis. Blood vessels of the hands and feet are mostly affected. Thromboangiitis obliterans commonly develop in smokers. Symptoms are those of reduced blood flow to extremity like coldness, numbness, tingling, or burning sensation. Ultrasonography is often used to detect decreased blood flow in the affected extremity. So next, vegetation. Vegetation is irregular bacterial outgrowth on the heart valve associated with the rheumatic fever. So vegetation, it is an abnormal outgrowth of the body part, especially in any warmthy exuberance on the valves of the heart that are composed of various tissues, elements including fibrin and collagen, and the typical of the endocarditis. So vegetation can build up in the heart due to endocarditis. It is an infection of the inner lining of the heart chamber and valves. In this infection occurs, bacteria, fungi, and other germs can invade your blood and in turn attach themselves to abnormal areas of your heart. This can build up is known as vegetation and can cause blood clots, which can cause serious damage to the heart and other vital organs. Structural defect or faulty valves in the heart are the mostly like causes of suffering from this infection and the build-up of vegetation. Although some with a healthy heart can develop vegetation due to other causes such as poor mouth hygiene. Last, Wolff-Parkinson-White syndrome. It is a cardiac arrhythmia consisting of tachycardia and a premature ventricular beat caused by an intermittent condition pathway. In other terms, it is a relatively common heart condition that causes the heart to beat abnormally fast for period of time. The causes in an extra-electrical connection in the heart. This problem with the heart is present at birth or congenital. Although symptoms may not develop until later in life, many cases of diagnosed in otherwise healthy young adults. Wolff-Parkinson-White syndrome, there's an extra electrical connection in the heart, which allow electrical signals to bypass the usual route and form a short circuit. This means the signal travel around and around in a loop, causing episodes where the heart beat very fast. In The extra electrical connection is caused by a strand of a heart muscles that grows while the unborn baby is developing in the womb of the mother.
Hi everyone, my name is Para Nicole Manalili and I'll discuss the heart disease. So first of all, what is heart disease? Heart disease is a genetic term that includes many types of heart problems. It also called cardiovascular disease, which means heart and blood vessels disease. There are some signs that you have a heart disease. The first one is stomach pain and indigestion. Madalas na pagkirot o burning sensation sa tiyan na pakiramdam ng hindi natutunawan. The next one is feeling sweaty. Madalas na pagpawis kahit hindi naman mainit ang panahon. Next one is arm pain. Madalas na pagkirot ng mga braso, lalong-lalo na sa kaliwang bahagi. And extreme fatigue, which means pakiramdam ng sobrang pagod kahit hindi naman kumikilos o walang ginagawa. The last one is irregular heartbeat. Di regular ang pagtibok ng puso. Those are some signs that you have a heart disease. So, how we prevent heart disease? First one, don't smoke or use tobacco. Next is eat healthy food, maintain a healthy lifestyle, get quality sleep, reduce your alcohol consumption, keep your blood pressure normal, and keep more physical active. We can help prevent many other types of diseases by getting regular physical activity and avoid things that may affect our healthy to keep maintain a healthy weight and lower blood pressure, cholesterol, and sugar level.
Good morning everyone. I'm Leopold M. Martinez. I'm here to present the diagnosis and treatment. First is ablation. Ablation is removal or destruction in cardiac ablation. A catheter is used to destroy a portion of the heart conduction pathway to correct an arrhythmia. Ablation is a medical procedure where tissue is removed or destroyed. Often importance lies in treating various conditions. For example, cardiac ablation is heart rhythms, while in cancer treatment, ablation can target and eliminate tumors, and function of ablation is to remove or disable abnormal tissue, restoring normal function, and alleviating symptoms. Next is angioplasty. Angioplasty is a medical procedure used to open narrowed or block blood vessels, usually arteries. Its importance lies in restoring proper blood flow. The function of angioplasty is to improve blood circulation, especially in cases of coronary artery disease. Next is artificial pacemaker. Artificial pacemaker, a battery-operated device that generates electrical impulses to regulate the heartbeat. It may be external or implanted, may be designed to respond to need, and may have the capacity to prevent tachycardia. Artificial pacemaker is important for regulating the heartbeat when the natural electrical system of the heart is not functioning properly. Its function is to send electrical signals to the heart to help it beat in a regular and coordinated manner. Next is cardiopulmonary resuscitation or CPR. CPR is restoration of cardiac output and pulmonary ventilation after cardiac arrest using artificial respiration and chest compression or cardiac massage. CPR is important because it can save life during emergencies when someone's heartbeat or breathing has stopped. The function of CPR is to manually pump blood and provide artificial breaths to keep vital organs, especially the brain, supplied with oxygen until professional help arrives. It involves chest compression to maintain blood circulation and rescue breath to supply oxygen. And last is cardioversion. Cardioversion is correction of an abnormal cardiac rhythm. May be accomplished pharmacologically with antiarrhythmic drugs or by application of electric current. Cardioversion is important for restoring a normal heart rhythm. especially in cases of abnormal or irregular heartbeats. Its function is like a reset button for the heart's electrical system. During cardioversion, a controlled electric shock is delivered to the heart, briefly stopping in its activity. This allows the heart's natural pacemaker to reestablish a regular rhythm. It's particularly useful for conditions like atrial fibrillation. In essence, cardioversions help get the heart rhythm back on track, promoting efficient blood circulation and reducing the risk of complications. And that's all. Thank you for listening.
Good day, nurses. I am Alan May as Martinez, and I will be discuss the other four diagnoses and treatments of the cardiovascular system. First is the coronary angiography. Coronary angiography is a radiographic study of the coronary arteries after introduction of an opaque dye by means a catheter threaded through blood vessels into the heart. So, coronary angiography is a procedure that uses a special dye or contrast material and x-rays to see how blood flows through the arteries in our heart. Coronary angiography is sometimes performed with cardiac catheterization. This is a procedure that measures pressures in the heart chambers. Coronary angiography is performed to detect obstruction in the coronary arteries of the heart. During the procedure, a catheter or the flexible tube is inserted into an artery in our arm or groin and then threaded carefully into the heart. The blood vessels of the heart are then studied by injection of contrast media through the catheter. A rapid succession of X-rays or fluoroscopy is taken to view blood flow. So the next one is the coronary artery bypass graft or the abbreviations of CABG. Coronary artery bypass graft is a surgical creation of a shunt to bypass a blocked coronary artery. The aorta is connected to a point pass obstruction with another vessel or another piece of vessel, usually the left internal mammary artery or part of the legs of saphenous vein. So, coronary artery bypass graft or CABG is a major surgical operation where atheromatous blockage in a patient's coronary arteries are bypassed with harvested various or arterial conduit, and CABG is an important surgical procedure helping prevent major morbidity in a patient's life by relieving anginal symptoms and improving quality of life. Appropriately selected patients receiving CABG have increased survival benefits compared to those receiving medical therapy or PCI alone. It is also a procedure used to treat coronary artery disease. Coronary artery disease or CAD is the narrowing of the coronary arteries, the blood vessels that supply oxygen and nutrients to the heart muscle. CAD is a caused by build up and of fatty material within the walls of the arteries. This build-up narrows the inside of the arteries, limiting the supply of oxygen-rich blood to the heart muscle. In general, on-pump and off-pump are the two types of CABG surgical procedures, within the difference being the use of cardiopulmonary bypass circuit and unarrested heart to operate during an on-pump CABG. So, why might we need coronary artery bypass surgery? Our doctor uses coronary artery bypass graft surgery to treat a blockage or narrowing of one or more of the coronary arteries to restore the blood supply to our heart muscle. Next, diagnosis and treatment of cardiovascular system is a coronary calcium scan or the heart scan. So, Coronary calcium scan is a method for visualizing vessel narrowing calcium deposits in coronary arteries. Useful for diagnosing coronary artery disease in people at moderate risk or those who have undiagnosed chest pain. A coronary calcium scan is a special computerized tomography or CT scan of the heart. It looks for calcium deposits in the heart arteries. A buildup of calcium can narrow the arteries and reduce blood flow to the heart. A coronary calcium scan may show artery disease before you have symptoms. Coronary calcium scan results can help determine the risk of heart attacks or strokes. Results from the scan may be used to plan or change treatment for coronary artery disease. Other name for this test are coronary artery calcium or CAC test, coronary calcium CT scan, and heart CT calcium scan. But a coronary calcium scan is not recommended as a general screening test for those known to be at higher risk for heart attacks. So the last diagnosis and treatments of cardiovascular system that I will discuss is the creatine kinase MB or the CKMB. Creatine kinase MB is the enzyme released in increased amounts from cardiac muscle cells following myocardial infarction or MI. Serum assays help diagnose MI and determine the extent of muscle damage. So, creatine kinase MB or CKMB test is a test that looks for a specific type of enzyme in your blood to diagnose or rule out of a heart attack. However, CKMB is no longer the blood test of choice for diagnosing heart attacks, and many hospitals are no longer use it because there are better test methods available that the cardiac troponin tests are currently the test of choice today. Creatine kinase MB or the CKMB is an enzyme, a molecule that helps speed a certain chemical reactions that occurs naturally inside muscle cells throughout our body. Different forms of CKMB occurs in different places, and most of the myocardial band or MB versions of the enzyme occurs in muscle cells in our heart. CKMB is performed because it is useful for diagnosing heart attacks, which are life-threatening medical emergencies. Hospital emergency room is where most CKMB tests happen. However, you might also undergo a CKMB test when you are patient in hospital if your healthcare provider suspects a heart attack or other injury to your heart. And that's all. For the next diagnosis and treatments is will be discussed by Marian K. Lopez.
Good day everyone, I'm Marian Lopez and I'll be the next reporter. CTA or Computed Tomography Angiography is a medical imaging technique that combines a series of X-ray images taken from different angles to create detailed cross-sectional images of blood vessels. CTA is used when you have an abnormality that involves the blood vessels of your heart, brain, and others. Defibrillation is the use of an electrical current to help your heart to gain a normal rhythm when a potentially an abnormal heart rhythm is happening. They use this when they need to revive someone from a sudden cardiac arrest. Echocardiography, also known as cardiac ultrasound. It is used to examine the heart and it uses sound waves to show how blood flows through the heart and heart valves, and this test can help healthcare providers diagnose the heart condition. Lipoprotein. These are particles made of protein fats and they carry out cholesterol through your bloodstream to your blood vessels. Lipoprotein are classified according to density VDL or very low density, LDL or low density, HDL, or high density. That's all. Thank you. Now may I call on the next reporter.
Good day everyone. I am Regine Florendo and I will continue to discuss the other diagnosis and treatment. So the next is percutaneous transluminal coronary angioplasty or PTCA. This is the dilatation of a sclerotic blood vessel by means of a balloon catheter inserted to flatten plaque against the arterial wall. Next is stent. Stent is a small metal device in the shape of a coil or slotted tube that is placed inside an artery to keep the vessel open after balloon angioplasty. Next is stress test. This is the evaluation of physical fitness by continuous ECG monitoring during exercise. In a thallium stress test, a radioactive isotope of thallium is administered to trace blood flow through the heart during exercise. Last is troponin or TN. Troponin is a protein in muscle cells that regulates contraction, increase serum levels, primarily in the forms TNT and TNI indicate present myocardial infarction or MI. That's all. Thank you and God bless you all.